The need for pediatric behavioral health services never seems to wane. We recall back when the pandemic hit and the effect that it had on children to not be social and be home all the time. The need is always there.
Hiring folks was very difficult in terms of recruiting, but Kids Minds Matter has really given us a leg up. We've been able to, because of Kids Minds Matter, have a scholarship through FGCU, which we awarded 2 folks that scholarship, and it's just absolutely amazing to see what that will do moving forward. We currently have 6 FGCU students that are interning within our offices. And so what we're really trying to do is grow from within instead of just trying to find outside, which I'm really excited about. When we have people from Florida, I think they have a different feel, and I think they also have a different appreciation of what this community means.
These children are receiving the care they need, and they're getting it in the community, and we've wrapped the community support around them. We've treated the bulk of the children with the anxiety and depression, and those children will keep coming.
As we continue to develop the pediatric behavioral health program, we have found we need clinicians that specialize in certain areas, whether it's more intensive programs that are needed outside of the hospital setting, whether it's more in clinic setting. We're identifying those as time goes on, and it's amazing how the more you build, the more you find that there's a need out there.
Why it's so important is, sadly, every 52 minutes, someone passes away from disordered eating. And that could be because of cardiovascular complications. It could be because of suicide related to their eating disorder. So a significant need. And sadly, without getting the proper care, eating disorders don't naturally go away. So you need a multidisciplinary team to really care for these patients. About 22% of the population will be affected by some form of body image issues, dieting, eating disorders, if it actually gets to that level. As best as we can do to build a program here and keep these patients locally is so critical for these families because they're in a crisis mode. And I don't want to add an extra layer or an extra burden to their care. So as much as we can try to do here in Southwest Florida, it's going to be so key for not only these families, but this community as a whole.
As we continue to develop the pediatric behavioral health program, we have found we need clinicians that specialize in certain areas. For example, with the opening of the eating disorders clinic, we needed a psychologist to be able to have that heart and to be able to care and have those skills that really help a child that's in crisis from an eating disorder. Another area is endocrinology and those children that have diabetes, and they need a specialized counselor to be able to help them through the medical crisis and to help them learn how to live with their disability.
I think Rising to Shine is making sure that it's a family event. It's a family issue. So I think what would take us to the next level is really focusing on family units. And what that unit looks like is different. It's very different. It sometimes is parents, but sometimes it's grandparents. Sometimes it's an aunt or an uncle that's stepping in. Sometimes it's foster placements or adoptive parents. And we have to realize that that's part of rising and shining now, is that we have to look at things in a bigger way, not just the child or the children, but rather the family units.
That's why funds are so critical to invest in programs, because we can't do it alone. So I'm very blessed that we have a dietitian and a PA and a therapist, but we need more. We need more supports, and it's your generosity that really helps us get there.
In order for us to create and stand up these programs that take care of children in our community, we require philanthropic support and the support of the community to do so. We take the money that our community so generously gives, and we are able to then start the programs that our children require and get them started and off the ground. And then once that volume is there and we're treating these children, then we are able to sustain those programs moving forward.